Hello and welcome to the course Introduction to Brain and Behavior. I am Dr. Arak Verma from IIT Kanpur. We are in the 6th week of the course and we will talk about emotion and its influence on other cognitive processes. In today's lecture, we will talk about the influence of emotion on attention and perception. Now, it is known that individuals exhibit an increased awareness for and pay attention to emotionally salient stimuli. If a stimulus is having some kind of emotional significance, your attention will go towards it more rapidly than as compared to a stimulus that has no emotional value. Now, researchers investigating attention typically use the attentional blink paradigm, in which the stimuli are presented so quickly in succession with each other that an individual stimulus is very difficult to identify. Typically, the interstimulus interval in attentional blink studies is around 75 milliseconds, which makes it very hard for participants to actually be able to see the individual stimulus. Individual stimulus are usually very simple stimuli like alphabets or letters, alphabets that are letters or digits, and the idea is that the participants are typically asked to detect couple of targets, the first target and the second target during this RSVP or rapid serial visual presentation of stimuli. So, when participants are told that, and sometimes what happens is that the participants are told that they can ignore most of the stimuli, say let us say all words printed in green, and attend to only a few targets printed in blue. So, in a RSVP stream of green words, there will be 2 blue words that you have to track. The participants are in this case typically able to identify targets. However, because the time is so limited between these different stimuli, it is a very difficult task to do. Now, if a second target is target stimulus is presented immediately after the first in the early lag period, in the early period of the RSVP stream, when the gap between one stimulus and the other one is very small. If a second target is if this second target stimulus is presented immediately after the first stimulus, participants will often miss the second target. They will not be able to see or report the second target. This impaired perceptual report reflects the temporal limitations of attention and is referred to as the attentional blink effect. If, however, the second target is emotionally significant, then people have been found to be able to report it even in the case of early lag periods. Now, an emotionally significant word is distinctive, and basically people are able to notice it even if it has a, say for example, positive or a negative valence. In the attentional blink experiments, arousal value, not the valence of the word or its distinctiveness, is capable of overcoming the attentional blink effect. So, somebody might ask, why are participants able to report these emotional words in the RSVP stream, where they are not, whereas they are not able to report other kinds of stimuli. The arousal that is generated by these words typically governs this process. So, if a word is high arousal, it is highly likely that it is going to get noticed. Now, studies have shown that when the left amygdala is damaged, however, the patients do not recognize the second target even if it is an arousing word. Okay, we were having this discussion about arousal and the role of amygdala in retention of arousal related information in the end of the last lecture, and it is sort of continuing on the same line. So, it seems that when the attentional resources are sources are limited, it is the arousing stimuli that reach awareness, and that the amygdala plays a critical role in enhancing our attention to these arousing or the emotional stimulus. There are 2 theories about the mechanism of this effect. The first theory arises out of fear conditioning studies that are done on rats, and it was found that the auditory cortex would become especially sensitive to the stimuli that is used for the conditioned stimulus. So, what if a sound stimuli is used with the as a conditioned stimulus with the fear inducing unconditioned stimulus, then the auditory cortex of these rats becomes extremely sensitive to detect this sound stimulus or to analyze this sound stimulus. Classical conditioning and fear conditioning shift the tuning frequency of the cortical neurons to the frequency of this conditioned stimulus. So, the participant will be able to appreciate this sound in all its detail. Now, this cortical plasticity of the receptor field of these auditory cortex neurons is very associative, and it is highly specific. Associative in the manner because it is pairing the aversive event with the this conditioned stimulus, but it is highly specific as well. It is not is not general across the entire auditory cortex. It happens very quickly, and it is also retained rather indefinitely. It is retained for large amounts of time. Now, the idea here is that changes that occur in perceptual processing for stimuli with emotional properties are long lasting. Once you have encountered with the stimulus that has some emotional significance, something that is very pleasant, or more in the case of something that when there is completely unpleasant or negative or aversive, then this association between that stimulus and this stimulus will, and this emotional property negative more specifically, is learned and retained for much longer times. Although a similar mechanism has not been explicitly demonstrated in humans, hints of it have been observed. In imaging studies in which fear conditioning occurred using subliminally exposed phase stimuli as the conditioned stimulus, with an aversive loud noise as the unconditioned stimulus, and increased responsiveness to the conditioned stimulus or these phase stimuli was seen in both the amygdala and in the visual cortex over a series of trials. So, when a loud noise is presented and a face is paired with it, after a few trials there is higher activity both in the visual cortex and the amygdala for these phase stimuli. Now, the presence of a learning response occurring in parallel in the amygdala and the visual cortex supports this idea that the feedback efferents that go from the amygdala to the visual cortex can actually modulate the visual processing of emotionally salient stimuli. So, we are learning a lot of things about the amygdala. One of them is that it can actually not only modulate the activity of the hippocampus, but it can also activate the initial visual processing of these emotionally salient stimuli. The second theory proposes a mechanism that produces a more transient change in attentional thresholds. Okay. So, as we know that the amygdala has reciprocal connections with the sensory cortical processing regions, and that it receives the inputs from the emotional significance before even awareness takes place. Research has shown that attention and awareness do not have much impact on the amygdala's response to fearful stimuli. If you remember the high road, low road thing of Ledoux, it is understandable, okay, it is intuitive almost that attention and awareness do not really impact amygdala's response to fearful stimuli, because information is coming through the faster lower road, which is consistent with the findings of that the emotional qualities of stimuli are processed automatically. Okay. Now, the proposed mechanism for this attentional change to emotionally salient stimuli is that early in the perceptual processing of the stimulus, the amygdala would receive the input about its emotional significance already prior to the perceptual processing or visual processing has completed, and through projections to the sensory cortical regions, it automatically starts modulating the attentional and perceptual processing. So, for example, if you are seeing something, let us say some negative aversive stimuli, let us say a snake or a spider, even before you can the sensory regions can make out that this is a snake and kind of get you a detailed information about this, amygdala has got this information and it has sort of now what it is trying to do, it is trying to modulate the initial processing of those emotionally salient stimuli. That is probably what is happening. This idea is based first on the finding that there is actually an enhanced activation of visual cortical regions to novel emotional stimuli, combined with also imaging studies that actually show a correlation between the visual cortex activation and amygdala activation in response to these same stimuli. So, if an emotional stimuli is presented, typically what is observed is that the firing rate of the amygdala and of the sensory cortical regions are sort of correlated with each other, which probably means that the amygdala has some way of modulating the visual cortical activity. Okay. There is evidence also, let us move to the different characteristic. There is evidence also that novelty is a characteristic of a stimulus that also engages the amygdala even independently of other affective properties such as valence and arousal. So, novelty is something that excites the amygdala. It is not just the valence, pleasantness, unpleasantness, it is not just the arousal that is high intensity, low intensity, highly excited, lowly excited kind of thing, but if something is novel, it is almost curious and it kind of engages the amygdala. So, an fMRI study that examined the role of valence, arousal and novelty of emotional pictures found that the amygdala had the highest peak responses and was activated for the longest time for novel stimuli versus familiar stimuli, and this effect was independent of both the valence and arousal of these stimuli. Also, investigators have observed that increased activity in early visual areas V1 and V2 was found when participants were viewing novel visual stimuli, and this activation was different from the activation that was later reported in the slightly higher visual areas, which was for valence and arousal. So, novelty is probably a different characteristic than valence and arousal, and novelty is also in that sense a characteristic that the amygdala seems to be interested in. Further, fMRI studies have shown that patients with damage to the amygdala do not really show significant activations for fearful versus neutral phases in the visual cortex, okay, whereas controls and patients with hippocampal damage actually do. So, when the amygdala is damaged, patients do not really show a high activation for fearful versus neutral phases in the visual cortex. So, basically if that information that this face is very fearful etc., does not really go to the visual cortex, it does not really it cannot modulate that activity, whereas control patients and even patients with hippocampal damage actually show significantly higher activations for fearful phases versus neutral phases. It is, if you kind of combine all of this together, it is therefore clear that the amygdala has a leading role in mediating the transient changes in visual cortical processing, let us say especially for emotionally salient stimuli. Moving further, let us talk a little bit about emotions and decision making. Now, researchers have been wondering about how do emotions affect the decision making process. In 1999, in the 1990s, Damasio and colleagues at the University of Iowa made a surprising discovery with a patient called EVR who had orbitofrontal cortex damage. When EVR was faced with a social reasoning task, he could generate solutions to problems, but he could not prioritize his solutions based on the ability to solve the problem. So, for example, if there is a problem, you give me 3 options. So, options this person can generate, but it cannot tell me which of the 3 options are better or should be used first and second and third. In real life scenarios, EVR made poorer decisions about his professional and social life. So, in some way the decision making or emotional decision making is affected. The researchers studying a group of patients with similar lesions actually found that the patients had difficulty anticipating the consequences of their actions, and they did not learn from their mistakes. So, here we are looking at a probable region that is kind of involved in decision making, but it is involved in decision making of a special kind. The decision making is about emotional decisions. The decision making is about decisions that may have emotional consequences for these individuals. You need to anticipate some of this. Okay, unless you anticipate what the consequences will be of making these choices, you will not be able to make the correct decisions. What is happening with patients of orbitofrontal cortex damage is that they are not being able to anticipate this. This discovery was surprising because at that time researchers believed that the OFC handled only emotional functions and would not really interfere or would not really participate in actual decision making. Okay, this was basically based on the knowledge that many connections of the OFC are there with the insular cortex and the cingulate cortex, the amygdala, the hypothalamus, all of which are involved in emotional processing. So, OFC and emotional processing linkage was alright, but people thought that probably emotions are not really involved in decision making. So, what can happen is that, say for example, if the OFC is damaged, it should actually enhance the decision making process rather than cloud it or something. Okay. So, Damasio wondered whether damage to the OFC actually impaired decision making, because emotions was actually a very important aspect needed to optimize this kind of decision making processes. Okay. And Damasio wanted to test this hypothesis, so they devised what is called the Iowa gambling task. This task is rather simple. There are decks of cards, there are 4 decks. 2 of these decks basically are going to result in net loss and net winnings, even though they have very low payoffs. Say for example, I keep 4 decks of cards, and these decks of cards I have to pick up each card, and each card will basically involve some kind of monetary gain or loss. So, I pick up this one, it gives me 10 rupees, I pick up this one, it gives me 50 rupees, I pick up this one, it gives me 1000 rupees, and this one gives me 2000 rupees. Now, what typically happens is these 2 cards, these 2 decks which basically are giving me lower payoffs, actually eventually end up in positive scores at the end. So, they end up in net winnings. These 2 decks which are giving me higher payoffs actually also going ahead have higher losses, and what happens is eventually this kind of leads us to net losses. So, 2 decks for net winnings, 2 decks for net losses. These 2 decks although have higher payoffs, these 2 decks although have lower payoffs. So, this is the Iowa gambling task. Now, let us see what happens. Participants, as I said, were not aware that 2 of the 4 decks are going to result in net winnings, although they had lower payoffs but and also lower losses. The other 2 decks, as I was telling you, was linked with net losses, although they had higher payoffs. Okay. So, healthy controls for this task, therefore, what participants actually needed to do was to figure out how they can earn the most money by choosing the decks associated with overall net winning and low payoff. Okay. Now, healthy controls and participants with damage outside this orbitofrontal cortex region gambled in a manner that maximized their winning. So, they could figure out which decks are leading to net winnings and they stuck to those decks. Okay. On the other hand, people with orbitofrontal cortex damage actually failed to realize the decks that would result in net winnings. Concluding from these results, Damasio proposed what is called the somatic marker hypothesis, and the somatic marker hypothesis is one that proposes that emotional information in the form of physiological arousal is needed to influence the decision making process. So, the idea is that the decision making process does take some kind of feedback from this emotional information or from some degree of physiological arousal. Now, when an individual is faced with the decision making scenario, the individual may react emotionally, wherein the emotional reaction would manifest itself in bodily arousal or in physiological arousal, which are referred to as the somatic markers. It is proposed that the OFC supports the association between a complex situation and the somatic markers associated with the situation. Suppose every time you are going for an interview, there is some kind of physiological reaction, something that is making you overexcited, nervous, sad, angry, I do not know what. But say for example, if a particular situation has a typical emotional reaction associated to it and there are some kind of physiological markers or associated to it. So, the OFC basically what it does is it links these 2 things, it maps up these 2 things. Okay. The OFC and the other connected regions, what they do is they evaluate previous situations that elicited similar patterns of somatic change. Once these situations have been identified, the OFC uses the experience to rapidly evaluate possible behavioral responses and the likelihood for reward. So, for example, if you go to a particular shop, suppose you have a vice and that vice is, let us say gambling, and because we talked about the Iowa gambling task, let us talk about that vice. So, what happens is that every time you go to gamble, you lose. Now, what will happen is if you have been doing this for a few times and you have had that this physiological response to, okay, I am going to gamble today, I might lose and I am a bit nervous, but for whatever reason I want to continue gambling. What will happen is that the previous instances of this you are going to gambling will be compared with the current instance, what are you feeling, the same feelings will get aroused, and also evaluation of the likelihood for reward is going to be made. Decision making can then focus on the reward options outcome. So, for example, what do I do so that I get a reward? If I play, I am going to lose. If I do not play, I am probably going to save a lot of money. So, typically normal individuals would act in a way that they would take the better option and say, okay, I am losing these days, I should not gamble and I should go away from here, something like that. But people who will have orbitofrontal cortex damage will probably not be able to do this. Okay, so it is now established in some manner that emotions do influence decision making in some manner. Okay, how do they influence decision making? Probably through 3 factors. One is they influence the decision, the person's current emotional state. They also help anticipate the emotions that will occur after the emotion is made. Suppose after the decision is made, what will happen after you have lost more money by gambling? And once emotions after, 2 things, once current emotional state, once anticipated emotions that occur before the decision is made, what will I feel and you can tell yourself I will win this time and I will be very happy, or you can tell yourself that I might lose and I will be sad. So, the anticipated emotional state, and then once emotions after the decision has been made. Now how are you feeling? Are you now you're you're stepped in the gambling house, now how are you feeling? So, these three things will basically affect your decision making process. Now, it has been proposed that the Iowa gambling task may be difficult for patients with OFC damage, because it will need to it basically needs them to shift their initial perceptions of potential rewards from the risky decks, as the two net loss decks seem to have high rewards in the beginning, but eventually net losses. So, once you start picking up from these decks, you picked up these decks, you found 1000 rupees, you found 2000 rupees, but you have to figure out as the game goes by that you have to stop picking up from these decks, because these are leading you to losses as well. A normal individual without OFC damage will be able to make this switch from this initial profitable situation to a loss making situation, but so the OFC damaged person will not be able to do it, but a normal individual will be able to make this shift and quickly shift to these two decks, which are, even though they are giving you less money, they are giving you but they are going to result in overall net winning. Okay. Now, it seems that the OFC damage leads to the inability to respond to changing patterns of rewards and punishment. So, if a particular stimulus, as is life, is involved with different patterns of rewards and punishment, the OFC sort of or people with OFC damage cannot do that. They cannot keep up with the changing patterns of rewards and punishment. This finding is also consistent with research in monkeys with OFC damage, who actually find it difficult to reverse an association once it is formed. Single cell recordings in the monkeys have also identified specific neurons in the OFC region that respond only when reinforcement contingencies change. Okay. If the conditions of how they were getting the food pellet is changed, then these specific neurons respond. Now, Edmund Rolls and his colleagues, using the fMRI technique, determined that the OFC has different regions for reward and punishment. The lateral OFC is activated following a punishing outcome, and the medial OFC is activated for a rewarding outcome. Okay. Now, the amount of activation correlated positively with the magnitude of reward or punishment. So, the higher the reward, the higher the activation of the medial OFC, the higher the punishment. So, basically the lateral OFC is activated for a punishing outcome. So, if there is more punishment, the more activity will be seen in lateral OFC. The medial OFC is linked with the reward outcomes. The more the reward, the more activity in the medial OFC. Now, the medial region, so again just so that is what I was trying to say. The medial region showed increased activation when to reward, and also showed a decreased bold signal when punishment was meted out, as was the case with the lateral OFC, which was activated when punishment was given, but less activated when reward was meted out. So, an inability to represent the magnitude of rewards and punishments is supposed to lead to poor decision making. If this OFC is not there, if you will not be able to determine the amount or the magnitude of positives and negatives, rewards and punishments, and that will basically lead you to making poorer decisions, because you cannot estimate the magnitude of or the consequences of your decision making. Now, important aspect of this decision making process is regret. Regret is also a very important aspect. Now, as a decision makers typically work to minimize the feeling of regret by making choices such that they will not have to regret at the end. Okay. In contrast, disappointment is an emotion that is related to an unexpected negative outcome without the sense of a personal responsibility. So, regret is slightly more personal than mere disappointment. Now, people with OFC damage have been known to have normal emotional reactions to wins and losses, but they do not feel regret at all. Also, they do not learn from regret inducing choices. So, this is also probably a clue to how they make more poorer decisions. Okay, and they are not able to anticipate negative consequences of their choices. So, here you can see why the OFC might be so necessary for good proper decision making. To investigate brain activity associated with regret, Coricelli and colleagues induced regret in healthy participants by having them make a gambling choice, and then later telling them that the choice that they have not made was the better choice. Okay. Using fMRI, these researchers found that the enhanced activity in the medial OFC, the anterior cingulate cortex and the anterior hippocampus is actually correlated with increasing regret. So, these are probably the regions which are responsible for this feeling of regret. More specifically, the more the regret, the more activity was observed in the medial OFC. Also, they found that after multiple trials, their participants became risk averse, a behavior that was reflected within the medial OFC and the amygdala. So, their risk, these are the reasons that are learning to become risk averse, to sort of avoid making choices that will lead to regret in the later part. A similar pattern of activation was also exhibited just before making a choice. So, now they are basically also this region is probably linked with anticipation as well. Both of these findings and the others that we talked about suggest that the same circuit mediates both the experience and anticipation of the emotion of regret. Okay. So, apparently, now we can kind of try and sum this up. Apparently, the emotion one feels affects the decision making process. And Ellen Peters and colleagues actually have suggested that experiencing feelings about a stimulus and those that are independent of the stimulus, such as mood states, have 4 important functions in decision making. They act as information, they act as a common currency between different inputs and choices, they can focus the attention to new information so as to guide your decisions, and they can motivate the approach to avoid unfavorable decisions. So, basically they can motivate you to avoid regret making choices, things like that. Now, let us talk a little bit about emotions and social stimuli. Now, facial expressions is a very important aspect of emotions. Okay. Research has shown that identifying a person's face and identifying the emotional expression on the person's face are 2 different things, and they must be associated with 2 different neural circuits. People who have amygdala damage do not really have trouble recognizing the person's non-emotional facial features and their faces, but their deficit is specific to their inability of recognizing emotional facial expressions. Okay. Although some patients with amygdala damage can express and generate a full range of emotional expressions themselves, the damage is in recognizing these facial expressions. It has been proposed that the different neural mechanisms and the regions of the brain are at work for processing different emotions. Okay. Evidence for the same comes from the studies where investigators presented different facial expressions to participants while taking their PET scans to identify the brain areas uniquely activated for the emotions observed. Blair and colleagues 1999 applied the procedure to study the perception of the facial expression of anger, and they found that the right orbitofrontal cortex was increasingly active when participants were seeing angry faces, but not when they were seeing sad faces. So, you can kind of link that region to perception of anger. Neuroimaging studies in normal participants and patients who had anxiety disorders have reported increased activation in the amygdala in response to faces with fearful expressions, even when the participants were not even aware that they are seeing fearful faces. Okay, so, subliminally presented. Going further, when fearful expressions was presented subliminally and then masked with a neutral expression, the amygdala was still found as strongly activated as if participants were actually seeing fearful faces. So, in some ways, even at the subliminal level, the fear expression is being gauged and recognized by the amygdala. So, the involvement of the amygdala in evaluating fearful faces also extend to other kinds of social judgments. For example, indicating from the face whether a person is trustworthy, you can go to this person for help, or approachable. Patients with amygdala damage rated pictures of individuals as more trustworthy and approachable, although the same faces were rated by normal participants as untrustworthy. So, you can see that if the person has amygdala damage, they will not be able to judge whether the person is a trustworthy person or is an approachable person, because this is a social decision which needs to be made on the basis of fear rating of a person. Using extensive testing, Adolphs and colleagues found that while control participants consistently relied on, so why is this, or how is the amygdala kind of judging that the person's face is trustworthy or not? Using extensive testing adults and colleagues have found that while control participants consistently relied on their eyes to make on the region of the eyes to make decisions about expressions, individuals with amygdala damage like SM who had urban wake disease did not derive from information from the eyes and did not even look in the eyes of the faces to derive emotional information. So, what is probably happening is that some ways because of something they are not focusing at the eyes. Okay. In a different study, researchers masked the expressions of happiness and sadness to determine the brain regions involved with the automatic analysis of emotion, and they found that the amygdala activity was associated with the analysis of happy, but not the sad faces. So, happiness, fear, both are sort of linked to amygdala. Now, it has been proposed that the amygdala activation when looking at happy faces could also be because attention is drawn to the eyes when you want to kind of decipher whether a person is happy or not, and basically what is happening is that people are being able to derive whether some face is happy or sad by paying attention to the eye region. Okay. Pushing this finding a little bit further, researchers actually showed that they could even get SM who has bilateral amygdala damage to identify both fearful and happy faces by just explicitly telling her that you have to focus on the eyes. When she focused on the eyes, she could actually identify fearful expressions and happy expressions. Okay. So, it seems therefore that what the amygdala was doing was that it is involved in a system that automatically draws the participant's attention towards the eyes, then the information about the expression can be deciphered from the eyes, and then basically a successful recognition of a fearful face or a happy face might be made. So, it is known that impaired eye gaze is the characteristic of several psychiatric illnesses and social disorders in which the amygdala may be dysfunctional. Okay. So, basically it seems that if amygdala is damaged, attention will not automatically be grabbed towards the eyes, and people will not be able to read emotional expressions at least like that of happiness and fear, and they will not be able to form emotional bonds, much like what happens in autism. So, people have said, people like adults and their research have actually shown that it is possible through experimental manipulations to train people to start looking at eyes a little bit more, to start deriving that information more, and in that sense once they are able to derive that information independently of the amygdala, they will be able to make these recognitions and make these changes. So, this could sort of help as intervention with in individuals which have such kind of disorders. Research has also shown that the amygdala damage are not attributable, people with amygdala damage are not able to attribute personalities and motives to inanimate objects in experimental settings. Say for example, sometimes in experimental settings what happens is that you are shown these geometrical shapes, and you are asked that imagine that these shapes are actual individuals and they are moving to gain something, they are moving to maximize their profit, or something like that. So, people with amygdala damage cannot do that. They cannot just anthropomorphize, they are not able to attribute humanly features to inanimate objects. So, this is also something that the amygdala sort of mediates. The amygdala also seems to be activated during the categorization of people in separate groups on the basis of social factors, things like racial bias. There is an evidence of some kinds of racial biases existing between people of different races. Sometimes let us say the whites and the blacks, the whites and the browns and the blacks, and so on. So, all of these things are there. It seems that the amygdala probably is involved in some manner in these kind of judgments. Evidence for this fact actually comes from studies that have used the implicit association test, and this implicit association test is typically used to measure the degree to which the social groups are automatically associated with positive or negative evaluations. So, whether say for example all whites are good people, or all blacks are good people, or all whites are bad people, or all blacks are bad people, these kind of associations basically this IAT measures, and basically what it does is it tries to measure this bias. Okay. So, what happens here is that participants are asked to categorize faces from each social groups, white versus black, old versus young, while simultaneously categorizing words, good words and bad words. Okay. For example, it could happen that in one set of trials participants may be asked to respond to good words and black faces with one hand, and bad words and white faces with the other. And in other set of trials, they can actually react to good words and white faces and bad words and black faces, and they can kind of do that. Basically what this task is doing is that it is measuring the bias, and the bias is basically being computed by the difference in the response latencies between the black and good and white and bad kind of trials. Okay. Now, to study the neural basis of a possible racial bias, Phelps and colleagues in the year 2000 used fMRI to examine the amygdala activation in white participants while viewing black and white faces, and they found that the amygdala was activated when white Americans viewed unfamiliar black faces. Okay. Moreover, the magnitude of the amygdala activation was found to be correlated with indirect measures of bias, as was shown by the IAT task. Participants who had more racial bias as measured by the IAT task actually showed increased amygdala activity. So, the researchers concluded that probably the amygdala responses and the behavioral responses to these black versus white faces in white participants reflected some sort of cultural evaluation of these social groups, as has been modified by experience. So, you can sort of make this assumption, but evolutionary psychologists do not agree with this. They say that it does not really make a lot of sense for the amygdala or any neural circuit in the brain for that matter to have a mechanism for categorizing race, because that is not really useful at all. Rather, it would make more sense if humans were able to categorize the other humans on the basis of whether they are in group or out group, whether they are family members or not family members, or whether they are trustworthy or not trustworthy. Indeed, Kurzban and colleagues actually found that in the presence of stronger social categorization cues other than race, the categorization effects based on race diminished. So, although the amygdala might be mediating some of these racial biases, it is not the only thing. It is not something that the amygdala is basically tuned for. It is just that it kind of evaluates the cues for categorization, and if better cues are available, it will sort of help you categorize the faces socially on the basis of those other cues. I think that was all for today's lecture. I will meet you in the next lecture to wrap up this chapter on emotion.